I just had an initial certification for a new center last week, and this is what happened. And the first step is we receive the email probably a month or 2 months ago, and from the CDA after we got our the POC accepted, and they want us to go to the Peach portal and submit some documentations, and they need us to go to the CDA website and review, give us the instruction how to get there, and to the Peach portal, and we submit the application and the package again, and then the copies of the relevant license and the records and of all staff, including the consultant. And we need to submit their license, diploma, certification, the evidence of the physical exam, the TB clearance, and evidence that the employee, the staff, and including the contracted staff are aware of the elder abuse requirements, the confidentiality, the job duties, and all the forms that we already have them to sign, and also include the food vendor, transportation vendor, any contracted vendors' copies of the contracts, and also the ADH 006 form, and in-service training record for all, and complete the self-assessment. This is very, very important. I mark it here as in the right color, the PSA survey. And then after that, and then we receive another email probably a month after that, and indicate that they are going to conduct a Zoom survey. So they told us that the survey will be conducted via the Zoom, and a representative from the center will give the virtual tour, which we did, and also explain on the logistics of the center and how the services will be provided in each area. And once the congregate services are allowed. So this is just like the in-center survey. They actually come to the center, and they want us from the outside of the center, and will walk in the center and show all the operation hours, business hours, and then how you greet, where you greet the participant, receive the visitors, and where also that, in terms of TAS practice, we need to have a sanitation station, and how you log the temperature, how you log, what's the policy for apply for the TAS practice, and everything. And also after that, and the surveyor conducted individual interviews, and all the interviews scheduled via the Zoom. And they interviewed the administrator, the program director, the RN, social worker, activity coordinator. And for the initial certification, because they want to see and how to practice once the congregate services are allowed. So they still concentrate on the services and the qualifications and everything that are related to both. Actually focus on the congregative setting, and also ask something about the TAS as well. So we need to have both prepared for that. And because, the surveyor, major surveyor for the initial certification know me for a long, long time. So they didn't give, they said, I don't want to waste the time on you as the administrator, and you just move on to the program director. And for all the staff, they ask probably average about 15 questions. So in terms their qualifications, their job duties, and their working hours. And I can see that most focus is on the person-centered practice. So we have to be very familiar with the person-centered care. And actually, we didn't have all the in-service training on the TPSA survey. I just focus on the program director. What the advice or comment, the suggestion here for you guys, if you need to have the person-centered approach survey, no, the initial certification survey and the recertification survey, and you need to focus on the provider self-assessment, the survey tools with the 23 questions, covering the 6 categories as well to all staff they're going to interview. This is pretty much about the initial certification. If you need more questions, and we can communicate or after this session. And also that I received the recertification survey for one of my centers not long ago. I cannot release the information, the name of the center, but I just can generally talk about it. And the first step is, I remember on Monday, we received an email from the CDA, and it gave us 4 days to complete the documentation. And so the due date is on Friday. So we need to submit, the TAS key personnel staffing information, and we need to submit the TAS, the 006 form, and also we need to submit, because this is a brand new center, we just submit 2 participant health record. So I believe that Charles will talk more about health record and later on in this session, and also the discharge summary report that if you have. And we don't have it, and so we didn't submit that. And also documentation of the staff training, and including the new staff orientation training. So this is training, is the training part is very important. And you need to catch up with all the trainings, especially the orientation for the new staff. And also that they want us to provide the completed the provider self-assessment. And I suggest that here, at least the program director need to be familiar with that and know how to answer the questions, and especially how to, not only the questions, and you need to put in the content, and you need to be very careful about the supporting documentation, such as the policies and procedures, and the training record, health record, and the employee's record, and the information materials, anything you can show, and to support each questions. And this is very important. And the second step is we probably after a month or so, maybe 3 weeks, and then we receive another email, and no, not that long, and actually 2 weeks, less than 2 weeks. And we receive another email that they want to schedule the interviews. And the interviews, and they covered the program director and also the MSW. And this is the interview will be conducted between the CDA staff and the center staff, the PD and MSW. And then another email from the nurse evaluator, and the scheduled interview with the RN, and also the interview with 2 participants. And so after we finish that part, and probably 1 day after the last interview conducted, and we schedule the ACCESS conference. So the ACCESS conference is between the CDA staff, the nurse evaluator, and administrator, program director, and whoever you want to bring in the Zoom, the ACCESS conference held. So this is pretty much the experience of the survey that I experienced from one of my centers, actually 2 of my centers, and I hope this can give you some valuable information and for you how to prepare for either the initial certification survey or the recertification survey. So just like I just talked about it, and about the person-centered care, so PCC is a big deal. And I can experience like 2 years ago, and they touch base on the PCC and the self-assessment survey, and that was brand new, and they give you some time to train the staff to learn about it, and now they really start to implement and this person-centered care practice. So this is